I'm Rowan. I've transferred to Wuhan, China, lived and worked in a technology company for more than 2 years. Currently, I live in an apartment located in the heart of the city. I'm the only foreigner living in the apartment. This led me to be afraid of talking with neighbors because of the language barrier. As you might know, the new strain of coronavirus originated from Wuhan before outbreaking as a global pandemic and threatening not only poor countries, but also powerful countries in the world. Especially in Europe, COVID-19 epidemic has grown uncontrollably and killed hundreds, thousands of lives. It was so unfortunate for me to live in the center of the pandemic. I tried to minimize the number of times going out of my home these days. The whole of my apartment building had to be isolated at home. One day, all of a sudden, I was forced to go to a centralized isolation area with many of my neighbors after the police arrested an elderly woman showing signs of the acute pneumonia epidemic. Her family lives on the fourth floor, which is one floor below my apartment. Just like many others, I was forced to temporarily quit my job at the company and quarantined at home. It was not good to live without income. It was even worse that we were in the high-risk group suspected of being infected by the epidemic. Unfortunately for us, the woman was sent for testing and concluded to be positive with the coronavirus a few days later. This news immediately alarmed all of the residents living in the apartment. It was also the time when the epidemic outbreak. Every day, data on people infected with the virus, people dying from the epidemic, and recommendations appeared everywhere on the newspapers and television channels. Ambulance sirens were loud all over the streets. The morgue had no room to accommodate. The funeral service had to be closed due to overload. Human life became extremely fragile. That made it possible for me and the other people in the suspect group to sleep. However, it didn't stop there. A few days later, I received more shocking news about the woman infected with the coronavirus. A man in the quarantine area said that he shared the elevator with that woman in the previous day. He and some people felt uncomfortable because of her impolite actions. She coughed and spit indiscriminately in public, but they were just keeping the discomfort in their hearts without saying it because they never thought that she was positive for coronavirus. Moreover, a few days ago when returning from work, some people happened to see the woman peeping at a door, holding the door handle while there was no intention of opening it. But everyone thought that maybe she went to the wrong room, so they just turned a blind eye. Some people in the quarantine area said that the police quickly went to the security building. According to the data extracted from the security cameras, the woman had committed very inhumane actions. Since she knew that she had signs of infection, she was in despair and came up with a plan to spread the disease to all the inhabitants of the apartment building because the wicked woman wanted that everyone must suffer the same pain and despair as herself. Every day she deliberately smeared her drool on the elevator dials, on the stairs, at the door handles of each household. Even when she knew she had signs of the disease, the woman was still acting completely normal, not wearing a mask nor the necessary equipment to protect other people. Seeing the actions of the evil woman on the security camera of the building, everyone was shivering. Worse, she was also the chef of the cafeteria below the apartment. While cooking, she deliberately disobeyed the kitchen's rules, not wearing the drop-proof mask as usual. Even in some corners of the camera, the woman was seen spitting on the food before serving the guests. Performing a sinful action, her face was still as cold as ice without any emotion. Hearing this information, all the residents who had stopped at the cafeteria of the apartment for a meal were horrified. Certainly some of them would be infected with the disease, I'm sure of it. At that time, residents of the apartment building and I were thrilled every day waiting for our test results. A number of people began to show symptoms like coughing, high fever and shortness of breath. but only a few of them were lucky enough to be referred for treatment because hospitals were overcrowded. In the centralized quarantine area, we had body temperature and health checks anytime and anywhere, regularly on 3 meals, but all of us wore a sad face. People were more aware of wearing medical masks and gloves. It could be said that the greatest motivation for us to gain more strength to overcome this crisis was the image of the doctors and nurses, the guardians who were with us every day. They also wore thick and hot protective suits, not to mention all of them had to work day and night, struggling to fight the disease. In spite of their tiredness, they were always happy and even encouraged us. Luckily, I was negative for the disease. After more than 1 month of isolation, I was allowed to go back home. It was a scary story I encountered a few months ago, and currently the epidemic in Wuhan was under control, but the situation seemed extremely tense in Europe and especially my hometown. It could be considered as an uncontrollable one. I would say that I was extremely worried about my relatives and friends in the UK. I was not really satisfied with their subjective attitude before. When the epidemic was raging in Wuhan, China, even when they were the first victims of infection in the UK, people did not change their attitudes and views. On the streets, no one was wearing masks. The shops were still crowded. People still embraced each other as if nothing had happened. In short, no one consciously protects himself from the threat of the disease. Even my parents and siblings were teased because of wearing masks and gloves when on the road. As you know, living in an environment with less pollution and smog, it's understandable that Europeans like us don't need and don't have the habit of wearing masks. Besides, people think that someone who wears a mask is sick or has health problems. And if you are not sick but wearing a mask, will certainly be teased and ridiculed. No exception, I also used to have that idea. But since the coronavirus has grown into a pandemic, I've changed my mind. And at least I was aware of the importance of wearing a mask before things got worse. But unfortunately, most of the citizens in the UK do not wear masks. As the death toll rose to thousands, people began to rush to buy masks and hand sanitizers, leading to a serious shortage. I've never seen the Big Ben Tower or the Tower Bridge spanning across the Thames River that deserted. The hotels were also closed because there were no tourists. All were leveling off due to the epidemic. In hospitals, the corpses were laid close together in the morgue because there was not enough space for burial. The ambulance was noisy every day, and people have never been able to meet their loved ones one last time through a video call for only 5 minutes. More than anyone else at this moment in a faraway place, I was always hopeful that a miracle can happen. The disease will end, and I can return home. I felt a little bit insecure, but at least my sister was a master of karate. Since there is a forest behind our house, we assumed that it might be the trees that knocked down by the wind that broke the glass. Or worse, it could possibly be a wild animal that attacked our house. I hurriedly called our neighbors for help while Luna dashed into the storehouse to fetch a shotgun. The lid of the basement shook violently, and then there was the sound of axe cutting the basement lid. Luna grabbed the shotgun and aimed at the lid.